These are not the right scissors, but it's okay.
They have tough skin, huh? That's why they make belts out of them.
Right. Purses and shoes.
Yeah.
Here is that
Ooh.
Ooh.
thing we were feeling from the outside.
What's it connected to?
It's like the side of the intestines. What's that?
What's that?
It doesn't belong there either.
Is Mike female?
Mike is female.
Mike is female.
I'm just gonna...
Little ovary there.
Yeah.
That's pretty ugly.
That's gnarly.
Cut into it to find out if it's a tumor versus a granuloma or something, but it
Yeah.
looks pretty adhered. I think if you would have gone to surgery, sometimes, as you know, you get in surgery and then you just can't.
can't
You don't
get it
know
off.
till you actually try.
Right.
But sometimes you go to remove something and it's just too stuck to organs, and sometimes it's you risk tearing
Sure.
the other tissues. But it looks really maybe even growing from.
I was gonna say, does it have a blood supply?
Looks like it based on that tissue underneath it.
What's that?
Lungs.
Oh, okay. I guess they're empty. That makes sense.
But this is the stomach here.
Okay.
And this tumor, so this is the start of the small intestine
Okay.
2. And whatever
Oh,
this
it's connected. Right
tumor
there.
is all connected with the intestinal tract here. We can see this connection right here.
Okay. I mean, it almost looks like you could snip it off, I guess.
It's growing kind of right from the base of the stomach. Then.
Yeah.
Mm. Oh, it's really gross looking.
And then we can cut into the stomach. It might smell, but
Oh, okay.
just seeing if there's any kind of firmness or
Oh, okay.
growth on the stomach too. There's another one of these things
Oh.
which is also present near the liver.
Oh, it's like is it like a cyst?
Looks like they could be old ovarian follicles.
Oh,
They might be like little yolks that came off the ovary
I see.
and didn't develop.
And just floated
Because it
around.
kind of has a look of a little bit of a yolk material.
Okay.
Yeah, so
And-
it's possible that's what it is.
There's another one up
Yeah,
here.
that one's big.
So it's kind of like it just floated around and got stuck somewhere else. Gross.
quickly separate this here.
I mean, it looks like you would have been able to cut that off.
Yeah, and that, yeah, I guess that in retrospect, you never know. Soft.
Ooh.
Ooh.
So it is a tissue matrix,
Huh.
even if there is some necrosis in it.
See if there was any kind of
Scoop? You gonna scoop it?
to see, well, just to see if it, you know, this is filled with some kind of tissue.
Okay, like it's not a mashed potatoes. It's
Right. It's not filled
tissue.
with something.
Okay.
It's all the solid tissue.
Gotcha.
Yeah. It's not like you could scrape out contents, is what you mean.
Gotcha.
Yeah.
It's not a pocket. It's a whole thing.
Right, and because it was so attached into the GI tract too, you know, what is the factor of how much was that impacting? I mean, that doesn't belong there to begin with, as we said,
Sure.
at all.
It does kind of look like you might have been able to remove it. What's that?
This is just some of the tissue that connects all the GI tract
Like
together
this
into the
stuff.
stomach.
Okay.
And that's what was attached to this.
Right, and
That's what-
normally, like in surgery too, or in any live patient, just so we're aware, you can kind of see the residual blood vessels in it, but it's a very vascular structure. Like there's a lot of blood vessels, so it, as simple as it might be to just cut and
Right,
remove, there would
you have to
definitely
tie
be a
off
lot of
all
blood
of
vessels
those.
that are all connected to this thing and feeding this.
Gotcha.
All right, I can cut into the stomach here. There's, you said
I
he
fed
last
him
ate.
today.
Okay.
I gave him just, he wouldn't eat anything from my hand, but I syringe fed him. Her. Super worms.
Yeah.
I was taking them yesterday.
Okay, this is just kind of looking at the lining of the stomach to see if there's anything.
Okay.
At least grossly.
You really need your scissors on.
Yeah, I do.
Do you want me to go get another
I
pair?
think it's okay.
I'm just giving you a hard time. You're doing great.
Okay. But at least on the surface of the stomach, it doesn't appear to look that
It's so
abnormal.
smooth. Yeah.
What is that?
I don't know if it was material just before the pylorus.
Looks like tissue though.
There's another one of these free-floating things too. These firm.
Huh. Who to be a woman, Mike?
sure what that is. That little brown nodule.
Yeah, it almost looks the same as that big thing.
Because it's not on both sides, so these are like fat pads that bearded dragons have.
Okay.
But we can see that there's one of them down here. It's really well adhered to it.
Hmm.
I'm just going to take out the liver and heart area. There appears to be another set of these nodules high up here.
That's the things that don't belong.
Yeah.
You just never know the significance of them, but things that don't
Right.
belong.
You got a lot of weird stuff in you.
So it's these little white firm growths too, just on, this is the liver that I'm holding too.
And then what's that?
Here?
Air.
What's that?
No, here.
Oh.
Yeah, that nodule on the liver, that doesn't belong
It's
either.
not the gallbladder. This.
Is it?
Oh, no,
There?
no.
There's the gallbladder.
Oh wait, oh, that's my finger.
No.
it's not.
Yeah.
That's the gallbladder
Oh
there.
yeah, so then whatever
That's
this
a
is.
liver tumor.
Wow, the gallbladder is such a pretty blue. Oh, liver has the weirdest consistency.
Whatever this tumor in the liver.
Oh. I wasn't expecting that.
So the liver is very vascular too.
Okay. Could that just be like a hematoma or weird? It like went away.
Okay, the heart up here.
Cool.
It's the heart and lung,
Okay. Well, I think that's the major extent from this
Yeah.
necropsy. And in terms of just helping to summarize the big things, is the most pressing, of course, being this very large, soft tissue, cancerous, ugly
Certainly doesn't look nice.
structure,
Probably the cause of the hyperglycemia.
and also his wasting and
Yeah.
cachexia that we spoke about.
This
Her-
is a
correct.
girl. This is a
Right.
girl.
Correct.
We know for sure with her ovaries sitting
Now we know.
right there.
And then these various different inspissated.
Had a number of
Gross
things that didn't
nodules.
belong in there.
Yeah, I can always, this is up to you. Like, if we wanted to know definitively whatever this is it that gastric tumor
Right.
thing or something else, we would have to send it out.
Yeah, I don't care to know. If
Okay.
you want, you can do
I
whatever
would,
you want
but that
with
I
it.
know I can't do
Yeah.
the cost things with, so
You do
that
whatever
one,
you want, and I'll just take the main part of the
Yeah.
lizard home.
Do
You
you
can
have
even
any
keep
other-
all his guts.
Okay. But I will throw a few sutures just for
Okay.
my own peace of mind.
Yeah, and then if you just wrap him, he'll be all right.
And then
He'll go-
also there was that tumor
yeah,
down here, which doesn't belong, these individual ones, and obviously whatever that structure was
A
on the
number
liver.
of weird things.
Again,